Primary agriculture credit societies. These are beautifully known as PACs. Now, there was a recent news. There was a recent news saying that these PACs will slowly start acting as Ayushi Kendras. That means drug stores. Normally, what happens is there is a drug. Patent rights of that particular drug are with respect to a company. So the company, after buying the patent rights from the discoverer or the inventor, they start manufacturing those drugs and then it comes into the market. The sole right of that particular drug will be on that company only. Therefore, the company's name will be written. Okay. Now, on the company's name, you will have, if you look at any tablet, you will be able to see a company's name will be there. And below that, the chemical name and the drug name also will be given. Or sometimes the salt which is used is also mentioned. So, usual notion is till the expiry of the patent, only the manufacturer will have the right to produce the drug and market it and sell it and take the money. This is a normal notion. But what happens usually, what happens is they do it for business purpose. Therefore, their sole motive majorly will be, apart from health services, their motto is profit. But the other thing is, the cost of the product is on the higher side because it is produced usually by a private company. So what the government has always does is, there is a concept of something called generic drugs. Now what do you mean by this generic drug is, these drugs are very similar to the drugs which are, or the tablets or whatever, which are being manufactured by the private company, except that it does not have a brand image. These generic drugs are produced with the same quality but for a very affordable price, so that it can be distributed among economically backward sections. So this prime target is distribution with respect to generic drugs. So what do you mean by a generic drug? A drug which is manufactured with the same quality and same effect, same salt, everything same, except that it is available at a very affordable cost, so that it is very advantageous to the economically weaker sections of the society. So that is the whole concept. But these drugs have to be distributed at some point of time. That means these economically backward people need to know a place where the drugs are available. So previously it was at different stores, but now what they have done is, the government, under a particular Pradhan Mantri scheme, they have made these packs as the distribution centers of these generic drugs. So from now, with respect to a program, these packs will act as distribution centers for generic drugs. For whom? For economically backward sections. So that is reason the primary agriculture credit societies, PACs, will act as Jan Aushadhi Kendras. So that is the whole concept behind today's topic. Now let's look at some information. Very useful for your prelims, not for your mains. You can just use this example somewhere in your mains, but majorly this is for prelims. You have to remember about 4 to 5 points, very important. If you know that, that is sufficient. So Indian government has recently creating establishment of Pradhan Mantri Bhartiya Jan Aushadhi Kendras by inclusion of primary packs nationwide. As I told you. So what is it all about? What is a generic drug? It refers to the affordable versions of branded or patented drugs introduced into the market once the original drug manufacturer's patent expires. This can be done. So generic drugs are only produced after the expiry with respect to the manufacturer. So the medicines will possess same potency, quality and effects. That is what you have to remember. And generic drugs are marketed by either the salt or the brand name. So both of them can be possible. Moving on. What is a law which allows this to happen? It is established under Pradhan Mantri Bhartiya Jan Aushadhi Pariyojana. So under this, launched by which department? Department of Pharmaceuticals. Under which ministry? Ministry of Chemicals and Fertilizers in 2008 itself. So if you remember this part, useful for your prelims, they will ask you which department and which ministry. If you know that, that's sufficient. What is the objective of it? Providing quality medicines at affordable prices. That is the only thing. This part useful for mains. For economically disadvantaged. And once these generic drugs are put into the market, the advantage is the burden will not form on the government, because the government, if you have to provide only branded drugs, that means the cost is very higher. That means it will increase the debt on the government. If they are able to produce the same quality medicines for a lower cost and affordable prices on the healthcare system, the cost will reduce. That means the burden on the government will reduce. That is a whole advantage of it. Next, so how do you do that? The procurement, supply as well as marketing is through, please remember this, Pharmaceutical and Medical Devices Bureau of India. They established this Pradhan Mantri Kendras under the Department of Pharmaceuticals, Government of India, and they collaborate with public sector units for production, for mass production, procurement, supply and marketing of the generic drugs. So another beautiful advantage is it is also incentivized. An amount of rupees 5 lakh is provided for establishing a Pradhan Mantri Bhartiya Jan Aushadhi Kendra, which is nothing but your PMBKs. Pradhan Mantri Bhartiya Jan Aushadhi Kendras through this. So if you remember these points, I think that is more than sufficient. So generic drugs through PMBKs, Pharmaceutical and Medical Devices Bureau of India, and which government? Government of India. And what is the incentive? Rupees 5 lakhs for establishment of those kendras. They are fundamental distribution centers. I hope that is very important for your prelims.